Community Health Assessment and Plan Presentation by Nikole Gessler. I live in Madison, Wisconsin, a politically active city with a strong LGBTQ+ presence. My daughter, who is part of the LGBTQ+ community, has faced many mental health struggles, as many of her peers. Initially, I planned to work specifically with the LGBTQ+ high school students to provide coping strategies for anxiety and depression. However, as I connected with resources, I realized these challenges affect nearly all teenagers, regardless of gender identity or sexual orientation. Because of this, I expanded my focus. I was invited to speak to my daughter's high school health class, where I presented coping strategies for managing anxiety and depression. The goal was to provide students with practical tools to help them navigate their mental health challenges. Madison has a vibrant and supportive LGBTQ+ community, with organizations like Outreach LGBTQ+ Community Center, student groups at UW-Madison, and annual Pride celebrations fostering inclusion and advocacy. However, despite these strong networks, LGBTQ+ individuals still face significant challenges. One major issue is healthcare access and quality of care. While Madison has inclusive providers, disparities persist, especially for transgender and non-binary individuals who struggle with long wait times, insurance limitations, and even legal barriers to care. Mental health is another critical concern, as LGBTQ+ individuals experience higher rates of anxiety, depression, and suicide due to discrimination and social stigma. Organizations like Outreach and UW Health's Gender Services program are working to bridge these gaps, but more action is needed. Expanding provider training, improving insurance coverage for gender-affirming treatments, and increasing access to mental health services can help improve health outcomes for Madison's LGBTQ+ community. Located just blocks from the state capitol, Williamson Street, affectionately called Willie Street, is the heart of Madison's LGBTQ+ community. This vibrant area is home to inclusive nightlife, cultural institutions, and social support organizations that have shaped the city's LGBTQ+ identity. One of its most well-known establishments was Plan B, a nightclub that became an icon for LGBTQ+ nightlife when it opened in 2009. However, the club faced challenges, including discrimination allegations and vandalism, leading to its closure. It later reopened as Prism in 2019 with an even stronger focus on inclusivity. Beyond nightlife, Willie Street is also a center for LGBTQ+ advocacy. The Social Justice Center supports various causes, including LGBTQ+ initiatives, and runs the LGBT Books to Prisoners project, which sends educational materials to incarcerated individuals nationwide. Additionally, Broome Street Theater has been staging plays with queer themes since 1977, making a lasting impact on Madison's cultural landscape. Together, these spaces make Willie Street a cornerstone of Madison's LGBTQ+ community, offering support, advocacy, and cultural expression. Williamson Street is one of Madison's most progressive and LGBTQ+ inclusive neighborhoods. The area is known for its visible support, with businesses and residences proudly displaying pride flags. Its residents are mostly young professionals, couples, and families, but there's a noticeable lack of older adults and teenagers. Housing costs are a major factor, making it challenging for families with older children or college students to live here. From a health perspective, Dane County's leading cause of death includes heart disease, cancer, and unintentional injuries. Additionally, Black women face higher rates of infant mortality due to preterm birth. While many residents work in the service industry, higher-paying jobs are often located downtown or at large employers like Epic Systems, located in Verona, which is about a 20-minute commute. Healthcare in the neighborhood leans toward holistic services like acupuncture, chiropractic care, and meditation. There are no primary care clinics or emergency facilities within the community, but hospitals and urgent care centers, including major employers like UW Health, SSM Health, and the VA Hospital, are easily accessible. The local fire station provides fire and ambulance services, ensuring emergency response coverage. Despite some gap in services, the neighborhood's proximity to high-quality health care and employment opportunities makes it a desirable, though expensive, place to live. Teen anxiety and depression are growing concerns in Madison, especially in neighborhoods like Williamson Street, where high living costs and limited recreational opportunities contribute to social isolation. With fewer families able to afford housing in the area, there are fewer teenagers, reducing peer support networks and community engagement. While younger children have parks and seasonal activities, structured programs specifically for teens are lacking. Mental health resources in the immediate area tend to focus on holistic care such as meditation and acupuncture, rather than specialized adolescent mental health services. However, Madison does have a strong healthcare system, with organizations like UW Health and SSM Health providing psychiatric and counseling services within a short commute. While the neighborhood's inclusivity and progressive mindset create a supportive environment for mental health awareness, barriers like the high cost of living and lack of team-focused programming still need to be addressed. Expanding access to structured programs, coping strategies, and mental health education could help mitigate these challenges and provide better support for Madison's teenagers. The main objective of my project was to educate high school students about anxiety and depression while providing them with effective coping skills to manage their emotions. To measure the success of this intervention, I established clear, SMART goals. In the short term, after the educational session, at least 80% of students should report a decrease in their anxiety and depression levels after practicing coping exercises. Additionally, students should be able to identify 3 coping strategies they find most effective. The long-term goal is to assess whether students continue to use these skills. In 6 months, a follow-up survey will measure their confidence and frequency in applying at least one coping strategy in their daily lives. To achieve these goals, I conducted an interactive session in my daughter's high school health class. The session began with an overview of anxiety and depression, discussing common symptoms and emotions. Students then completed a self-assessment using a 0 to 10 scale to rate their current anxiety and depression levels. Next, students engaged in hands-on coping exercises, including controlled breathing, guided imagery, and sensory-based self-soothing techniques. The effectiveness of these exercises was measured by having students reevaluate their anxiety and depression levels after practicing each technique. Students then identified 3 coping mechanisms that resonated with them, ensuring they had personalized strategies to take forward. The session concluded with a discussion on emotional regulation using the PLEASE acronym and a review of local mental health resources available to students. By incorporating self-assessment and interactive strategies, this session provided both immediate relief and long-term coping tools for students struggling with anxiety and depression. Ms. Lindsay Beal is a dedicated and highly experienced health and physical education teacher at Bell Phillips Memorial High School in Madison, Wisconsin. With 16 years of service in the Madison Metropolitan School District, she also serves as the department chair, overseeing lesson planning, grading, budgeting, and student-teacher supervision. Beyond her teaching responsibility, she actively supports students' post-secondary goals, frequently bringing in guest speakers and writing letters of recommendation. For my project, Ms. Beal played a crucial role in ensuring my presentation was engaging and effective. She shared insight into her students' learning dynamics, particularly the challenges of keeping them engaged during a post-lunch Friday session. She also reviewed my PowerPoint to align with her curriculum and school policies, providing valuable feedback to tailor my content to her students' needs. To keep students engaged, Ms. Beal suggested interactive strategies, such as incorporating fidget tools and hands-on coping skill exercises. She also assisted with logistical planning, advising on classroom setup and technology use. Her guidance helped my presentation be more meaningful and interactive, ensuring that students gained valuable coping skills for managing anxiety and depression. For this project, I identified 3 key community organizations that provide essential resources for supporting teens struggling with anxiety and depression. First, Journey Mental Health Services REST program is a school-based initiative that partners with schools to identify students in need of mental health support. This program provides cognitive behavioral interventions and group therapy, strengthening school support systems and fostering student resilience. This could be a valuable partnership for Ms. Beal's health classes. Second, the National Alliance on Mental Health offers youth-based mental health interventions, equipping students with structured coping strategies and access to professional counseling services. These resources can help teens struggling with anxiety or depression find additional support beyond the classroom. Finally, the Wisconsin Department of Public Instruction Mental Health Program specializes in outreach programs and workshops focused on student mental wellness. This program helps educate students on essential coping mechanisms and connects them with long-term support networks. These organizations extend the support offered by Ms. Beal and her school, ensuring students not only gain immediate coping skills, but also have access to ongoing mental health services beyond their education. The interventions in this project were designed to address anxiety and depression in high school students by teaching coping skills through an interactive and engaging presentation. The primary focus was on Ms. Beal's high school health class, where the goal was to equip students with practical, evidence-based techniques for managing stress and emotional challenges. The session took place in a classroom setting, where I worked with Ms. Beal to ensure aligned with her curriculum. The intervention was implemented through a PowerPoint presentation that covered key information about anxiety and depression, such as their definitions, symptoms, and risk factors. Emphasis was placed on practicing coping mechanisms, including techniques like dialectical behavioral therapy, mindfulness, deep breathing, and self-assessment. A brochure was created as a take-home resource to summarize key points and provide students with a useful reference for future use. To maximize student engagement, several interactive components were incorporated. These included self-evaluation rating scales, where students rated their anxiety and depression levels before and after practicing coping strategies. Additionally, a hands-on segment allowed students to physically engage with stress relief tools like fidgets and participate in real-time coping exercises. The evaluation process included both the pre- and post-session self-assessments and a debrief discussion with Ms. Beal to assess student participation and response to the material. While time constraints limited the depth of some topics, students showed positive engagement with their interactive elements. Moving forward, modifications like increasing the time spent on hands-on coping exercises and reducing the lecture portion could enhance the effectiveness of the intervention. The overall implementation of my project was successful in delivering valuable mental health education and coping strategies to high school students. Ms. Beal provided positive feedback, highlighting the interactive elements, particularly the hands-on coping exercises, which were the most engaging and beneficial for the students. She also appreciated the take-home brochure, which will continue to serve as a resource for ongoing support. Students participated well, with many expressing interest in the stress management techniques introduced during the session. However, time constraints were a challenge, as I found myself needing to move quickly through some sections, which limited in-depth discussions. If I were to do this again, I would streamline the lecture portion to allow more time for interactive activities and student engagement. Additionally, I think incorporating real-life scenarios or peer discussions might help further enhance participation and retention of the material. Despite these minor adjustments, the project was successful, met its goal of providing practical, evidence-based mental health support, and was considered a worthwhile initiative by both Ms. Beal and myself. Madison, Wisconsin is a politically active and inclusive city, known for its strong LGBTQ+ presence and progressive community initiatives. However, despite the city's inclusivity, mental health challenges are still prevalent, particularly among teenagers. The lack of affordable housing and limited teen-focused recreational opportunities contribute to social isolation, leading to increased anxiety and depression in high school students. Through a windshield survey and community assessment, it became clear that while Madison does have robust healthcare options, there is still a significant need for more adolescent mental health services and education. My project aimed to address this gap by providing high school students with practical coping skills for managing anxiety and depression in a health class at Belle Phillips Memorial High School. With the support of Ms. Beal, the Health and Physical Education Department Chair, I designed and implemented an interactive session that included self-evaluation tools, guided coping exercises, and a take-home brochure for continued support. The intervention successfully engaged students, as evidenced by their participation and self-reported improvements in emotional regulation. However, time constraints did limit the depth of our discussion, and future presentations could benefit from increased student interaction and peer discussions. The project highlighted the importance of accessible mental health education and reinforced the need for continued efforts to support teen mental health wellness in Madison, Wisconsin.